Welcome to another episode where medical information is brought to you by working doctors within the NHS. With the current pandemic of coronavirus, COVID-19, you've probably been reading the news lately and heard all about the different types of masks on the market. This might have included cotton and surgical masks and the more specialised N95 and FFP2 and 3 masks. Donald Trump has even urged Americans at a press briefing recently to use their scarves as makeshift masks. Confusing, right? So just how effective are masks and what are the differences between them all? Are your bog standard masks really of use in stopping the spread of COVID-19? In order to understand the differences, there are some key things you must understand first. Number one is that COVID-19 is spread primarily through droplets which carry the virus in saliva and discharge from the nose. When a person coughs, sneezes or exhales, these droplets can then be deposited on surfaces and objects which can transmit the virus when a person touches it and subsequently touches their eyes, nose or mouth. Number 2, a bit more on droplets. Droplet and particle science is a whole other discipline, and there is some variation in the literature on which are classed as large particles and which are classed as small particles. Generally speaking, particles up to 100 micrometers in size are considered inhalable. They can be breathed in. It is mostly agreed that particles below 5 micrometers in diameter can travel deep down into the lungs. They are light enough to float in the air and can be blown and carried by wind. A number of these particles suspended in the air are known more commonly as aerosols. These can be generated to varying degrees when talking, coughing or sneezing. Particles greater than 5 micrometers are non-aerosol and termed respiratory droplets. When exhaled, because of their larger size, like most other things, they too cannot escape gravity and generally fall to the surface below within 2 meters or evaporate. Droplets greater than 20 micrometers would generally be classed as large droplets. Lastly, to make things even more confusing, there are also things called droplet nuclei. This refers to the dried out residual of droplets once the water content has evaporated, and these may carry virus particles within them. The debate is still ongoing about the route of transmission of COVID-19, though at present, the WHO position is that there is insufficient evidence to suggest COVID-19 is spread mainly through the airborne route. They have stated, however, that airborne transmission may happen in very particular circumstances, such as during aerosol generating procedures. These are specialized procedures carried out by medical staff. Now we've talked about how COVID-19 is transmitted, let's take a look at some of the most common masks on the market. Broadly speaking, they can be categorized into surgical masks and respirators. Respirators can be further subdivided into disposable or reusable, which includes half and full facepiece masks. Surgical masks and respirators are governed by different standards across the US, Europe, Australia and New Zealand, and also China. So what are the differences between surgical masks and respirators? Surgical masks are generally disposable and single use, whereas respirators may be disposable or have changeable filters. Surgical masks are loose-fitting and are used mainly to prevent droplets from the wearer from being expelled into the environment, whereas respirators are tight-fitting and primarily protects the wearer from inhaling hazardous airborne particles. So in terms of particle size, surgical masks may only offer some protection from the largest of droplets falling onto it. For example, saliva globules from someone sneezing directly onto your face. It would not protect you from the much smaller particles or aerosols we mentioned earlier from being inhaled, simply because there are too many areas of leak around the mask. Respirators can protect from both large and very small airborne particles, and we will go on shortly to look at just how small the particles they can filter. Depending on which part of the world you're from, respirators are given different names. The most common ones you've probably heard of are N95 and FFP. In Australia and New Zealand, these are called P1 to 3, and in China, KN95. Respirators conforming to standards should reach a minimum filter efficiency. The higher the percentage number, the more efficient the respirator should be in filtering out airborne particles. For example, the N95 filters out at least 95% of particles at 0.3 micrometers in diameter, whereas the FFP3 is at 99%. As you can see, N95 in the US is the rough equivalent to FFP2 in Europe, P2 in Australia and New Zealand, and also the KN95 in China, whereas US N99 is the equivalent of FFP3 in Europe. So it begs the question, how big is the size of a COVID-19 virus particle? Well, individual particle sizes may vary, but generally they are in the region of 0.12 micrometers, or approximately 120 nanometers in size. Compare this to other particles and you can appreciate just how small viruses are. But wait, you're probably wondering, didn't you say earlier respirators filter out particle sizes of 0.3 micrometers? So how can coronavirus particles be filtered out if they are smaller than that? Well, the exact science is complicated but very interesting. Essentially, 0.3 micron sized particles are considered to be the hardest to trap. Now imagine there being a net which represents the filter, and a marble is the 0.3 micron particle. Marbles travelling towards the net will mostly get trapped, but a very small few will pass through because they are the perfect size to do so. Any particle bigger than a marble, i.e. greater than 0.3 microns, let's say a tennis ball for example, are easily caught on the net. You would therefore logically conclude that any particle even smaller than the marble, i.e. less than 0.3 microns, would fit through the net even easier. Interestingly, it's a bit more complicated than that. When particles get that small, they start to behave very strangely. Because they have so little mass, they are bounced around like a pinball by even gas particles around them, something known as Brownian motion. As a result, they move in a random zigzag pattern that actually makes them easier to catch onto the net or filter media. Therefore, respirators are measured on their ability to trap the most difficult particle size of 0.3 microns, which is known as the most penetrating particle size. Taking the N95 mask as an example, if it can filter out 95% of particles at 0.3 microns, which are the hardest to capture, they can generally filter out smaller particles like COVID-19. If fitted correctly, respirators have generally been found to filter efficiently at particle sizes less than 0.1 microns, although the absolute lowest limit is difficult to pinpoint exactly. For respirators to be truly effective, they must be fit tested so a tight seal can be formed. Indeed, surgical masks do not have the same effectiveness or purpose because they are loose fitting. Fit testing is a process carried out by a trained professional where they ensure there is an adequate seal between the wearer's skin and the facepiece. This is most commonly done with various taste tests using different sprayed substances. If the wearer can taste or smell these while wearing the mask, then the fit test is deemed failed. Fit tests are an important point to bear in mind, particularly for members of the public who may wear inadequately fitted respirators and be given a false sense of security. Let's summarise under what circumstances would wearing masks be useful. Surgical masks are more useful to protect others from your secretions, otherwise known as source control, whereas respirators are more widely used in the medical and industrial settings where exposure to airborne particles would be a problem. A last point on homemade masks. As a rough comparison, in one 2014 study, using what are called particle penetration tests, cotton masks were found to block about 30% of particles fired at them, while cotton handkerchiefs blocked from 2% up to 13%. In another 2010 study, researchers looked at common fabric materials over 5 categories including sweatshirts, t-shirts, towels, scarves and cloth masks. On average, cloth masks blocked between 10% up to 26% of particles, while sweatshirts ranged from 18% up to 60%, t-shirts less than 14%, towels between 34 to 40%, and scarves between 11% to 27%. An interesting point to note is that the US Centers for Disease Control and Prevention have recently recommended the wearing of cloth face coverings in public spaces where other social distancing measures are difficult to maintain. As an end note, wearing masks alone is not a foolproof way to avoid infection of COVID-19. Don't forget, virus particles can also enter through the eyes, so in theory, effective eye protection is just as important. This particularly applies to healthcare workers. Wearing a mask should not be a substitute for good hygiene, copious hand washing and social distancing. It is a supplement to these very necessary measures and just one more layer of protection. We hope you found this video useful. And please subscribe and follow to see our next video on the science behind social distancing and why it is important.